So I thought I would try and keep some momentum by uploading another narrated PowerPoint, and I dug this one out of the archives, which I gave to a group of physiotherapy colleagues in 2012, and I'm aware it's not quite as a hot topic as the previous presentation on running shoes was, but it's a topic I find fascinating, and hopefully you will too. I'm going to try and make it shorter than the last presentation, and as it was aimed at videos initially, you'll see the content has a lot of academic references for those interested, but it's not too much into the hardcore physics of things. Topic here is leg stiffness, so we're going to be talking about how we could model the human leg as a spring, and a spring which is essentially under control of the central nervous system, and the central nervous system will modify the stiffness of this spring accordingly, and what that may mean for us as clinicians. But as I say, it's quite a sort of dip toe in the water sort of approach to this topic. We're not going to get into Hooke's law or anything too deep. We are, again, huge disclaimer being this is a very brief summary of some of the literature on a very, very vast topic. So before we get stuck into things, just a quick acknowledgement for my friend and mentor, Dr. Simon Spooner, a name you'll hear me pepper throughout this lecture, for the main reason being that he was the inspiration for this lecture. The majority of it was based on a lecture I saw him give, and I asked his permission if I could give it at an in-service training, and he kindly let me. And there really isn't much I know about this topic that I didn't learn from him, so a huge tip of the cap to him, and it won't be the last time you hear his name, as I said, through this talk. So a brief rundown of the agenda then. Firstly, talk a bit about leg stiffness and have a bit of a chat about what it is and maybe a few definitions. Moving on to surface stiffness, how this will interact with the leg, and again the sort of ramifications of how the surface perhaps will modify what the leg does, and then a series of sort of slides looking at various facets of things we consider in the context of leg stiffness. So considering performance, considering running technique, talking a bit about foot type. Not a huge fan of typing feet, but you'll see what I mean when we get to that slide. And ultimately, does it have any bearing on injury? And if so, is there anything that we think we should be considering with respect to leg stiffness on a daily or a clinical basis? A little bit about Spooner's zone of optimal leg stiffness, which I suspect may be a new term for most. And ultimately a bit of a summary and a bit of a talk about some of the clinical take-homes, if there are some. So in the animal world, it's long been known that the leg has an amazing ability to change its characteristics, particularly its stiffness. As you can imagine, this is useful for jumping and particularly for running. And if you look at certain sort of hunting animals, particularly the big cats, and you watch them on wildlife programs, what you'll see when they run is that there's very, very little movement of their head, which from a hunting perspective is incredibly useful, particularly with respect to your eyes not displacing too much and keeping your eyes on the prize, so to speak. And this is really rather well documented, and the work to look up is that of the Professor of Zoology, R. McNeill Alexander. It's published really vastly in this field with respect to animals, and also with respect to humans. Now in humans, of course, we don't need to worry too much about keeping our eyes on our dinner, but the sort of minimization of our center of mass, sort of and its vertical sort of excursion, is thought to be an important thing with respect to efficiency. And again, as we've already kind of touched on, it's the central nervous system which will essentially moderate the stiffness of the leg, and this will allow us to run on different surfaces without too much disruption, assuming everything is working as it should. So one of the easiest ways to visualize this is to think of it a bit like our own inbuilt intelligent suspension system, which some of the higher spec cars now, as I'm sure many of you know, have built into them also. So essentially a suspension system which tries to learn the surface the car is on and modulate the stiffness of its suspension springs for exactly the same reason, to minimize excursion. And in a car driving scenario, that means a much smoother ride. And in a running scenario, it means a much smoother pathway of your center of mass. So what do we actually mean by stiffness? And it's a question I'm sure that the clinicians listening will know the answer to, but stiffness is ultimately the load deformation characteristics of something, so how much it will deform under a given load or force. Now, if something does not deform very much under a given load, it is thought to be stiff, and if something relative to that deforms significantly under the same load, it is thought to be less stiff or more compliant. Compliance being the sort of opposite of stiffness, and they're two terms that we'll be using a lot through this talk. And we know that we can measure the stiffness of just a single muscle fibre, or the stiffness of a joint, or the segment of a limb. For the kind of majority of this talk, we're going to be talking about the entire limb. A bit of a simplification, but certainly something worth a good starting point. And the first thing to talk about with respect to limb stiffness or leg stiffness is the work that Farley did back in the late 90s, and his suggestion was, and it's a good place to start, that you will increase the stiffness of the leg with decreased joint flexions or joint excursions, and conversely you will decrease the stiffness of the leg with increased joint flexions or excursions. The easy way to visualize this is to think about how you would land if you jumped onto a concrete floor off of a wall. You would increase your joint excursions and joint flexions, and what you're ultimately doing there is trying to decrease the stiffness of your leg as you land. So that's a pretty good starting point to get your head around with regards to how the stiffness of the leg can change. So we define the leg stiffness as the entire leg, and I should mention that also includes the foot for the purpose of talking about global leg stiffness. And the next most important thing to get a grip of is the surface stiffness. So we define the surface as anything that the leg interacts with beneath it, which isn't the leg. So this most notably will be the ground, but also things such as shoes, foot orthoses will also come under the guise of the surface. And what we know, what research tells us, and is consistent telling us, is that the stiffness of the leg will tune itself, so modify itself to the surface we're on, to try and achieve a net stiffness which it considers optimal. Now it will do this within the first single step on a new surface, if of course it can, if the system is working. And this is what allows us to run along on concrete and then suddenly hit sand and maintain a reasonably efficient gait. The leg essentially needs to, again under the control of the central nervous system, to modify its stiffness depending on the surface beneath us. And generally speaking, Butler was believe the first to suggest that if you are on a stiffer surface, this will result in the leg becoming more compliant, and if you are on a more compliant surface, it will result in the leg becoming stiffer. And these changes, again, just the body's way of trying to achieve the optimum net stiffness. So what does this leg stiffness mean for performance? Well, research tells us that there is a direct relationship between stiffness and speed, and that is that as the velocity increases, the leg will get stiffer, and some suggest that as the leg gets stiffer, we will get faster as well. So you can see there's a real relationship between stiffness and speed, again to a point. And what we know is as the leg gets stiffer, we generally get an increase in running economy as well. Again, that will have a ceiling also, like most of these things. And finally, and this is fairly intuitive, I'm sure, as a runner, as a subject fatigues, the leg stiffness and the economy will decrease, and I'm sure there's nothing new I'm telling anyone there. So let's just give a few of the things we've just talked about, a bit of a real world application. And some people may be aware of Tom McMahon. What he doesn't know about springs isn't worth knowing. And back just the year before I was born, He was based at Harvard University, and he tinkered around with their running track, and it's fairly well documented. If you Google the Harvard University tuned track, you'll find out, you'll see evidence and discussions about it. And essentially he changed the surface to make it slightly more springy, so slightly more compliant, with the thought process, I believe, being that that would mean that the runners would have a slightly stiffer leg, and this would improve performance. And he was shown to be absolutely right. Most runners got on average 5 seconds faster per mile, and also I have read that injury rates were reduced by 50% also. So using his knowledge of the mechanics of the ground and essentially the central nervous system and the way it modifies the leg to the ground, he tuned the track to the runners. Now, after a while, a few of the other big universities apparently followed suit, so any advantages were lost, but it really shows how understanding this topic can bring real-world benefits. So it seems we can never do a talk about anything nowadays without touching on running technique, but it is something we talk to our patients about every single day, so something to consider. And where does leg stiffness fit into this? Well, researchers have shown that as we increase our stride length, our leg stiffness decreases. Now, perhaps an easier way to spin that around is if we decrease our stride length, our leg stiffness increases. So ultimately, in the real world, if we ask a runner to increase their cadence, they will get a stiffer leg. Now, just to clarify, I'm not suggesting this is a good or a bad thing, but just something to consider. And although we've talked about the leg stiffness globally to this point, just to break down things segmentally, just for the sake of this, because I think it's important to get your head around as well, and that is that if you adopt a forefoot landing, a forefoot strike, you will generally see increases in knee stiffness relative to the ankle. If you adopt a rear foot strike, you'll generally find that the ankle is a bit stiffer than the knee. Again, I'm not saying there are no sort of polarizations or, as I've said before, no right and wrong. It's not black and white. Things to consider based on the person in front of you, their pathology, etc. So foot type. Now, I'm not a huge fan of typing feet. It's not something I do clinically, but I'm sure everyone's aware that historically people have sometimes been grouped into either having high arched feet or into having low arched feet, and for the sake of the point we're discussing here, that's what we're going to adopt as well. This is, of all the things we've talked about, changing leg stiffness, this is one thing that of course won't necessarily be within our ability to change. Now, what Williams and colleagues showed in 2004 was that high arched feet will generally exhibit increased leg stiffness, and conversely low arched feet will generally exhibit decreased leg stiffness. And that's fairly intuitive, and I think it probably ties in with the historical approach to telling people with high arched feet that they're poor shock absorbers, or similar terminology to that. So where does injury fit into this? Undeniably a topic we're all close to all of our hearts, and we've kind of touched on the possible benefits of the leg exhibiting sort of qualities of being stiff or being more compliant. But as with all things, there will always be a top limit and a bottom limit. And a few researchers over the years have postulated that if a leg shows increased stiffness, then its injury profile may be more likely to be bony. So things like stress fractures, etc. And again, the opposite of that being that if a leg is too compliant or not showing enough stiffness, it may allow for excessive joint excursions and therefore predispose an individual to more sort of soft tissue injuries, things like tendinopathies and things. Now, if we take that as true, then, and we can be too stiff and we can be too compliant, then it's fairly intuitive that there may be an ideal sort of area in the middle about which is optimum for us. As with all things, it will be person specific and no doubt activity specific. And my friend Simon Dr. Spooner coined this phrase, and I'm convinced he's the first person to coin it. I've not heard anyone speak of it before, and he's referred to it as the zone of optimal leg stiffness, within which if we perform, we are hopefully performing to the best of our ability with respect to performance maximization, but more importantly, injury minimization. So we're going to talk a little bit about this zone and give you a few sort of theoretical examples. So here's a sort of visual depiction of what I've just said, whereby we have a scenario where an individual's leg stiffness at the top end would be too stiff and theoretically predispose them to bone injury, or an individual's leg stiffness would be too compliant at the bottom end here and potentially predispose them to soft tissue injury. And like we've said, in the middle here we have sort of highlighted this zone of optimal leg stiffness, which I've abbreviated. Now it's fair to say that intuitively I straight away put it right in the middle, but as we know, humans don't often work like that, and we certainly know that there is subject to subject variation. There's absolutely no reason that it couldn't be up here. Ultimately it will be a zone about which the leg stiffness is optimal. It will be somewhere between the two extremes of being too stiff or too compliant, and as I've already said, and at risk of repeating myself, it will be person specific, it will be activity specific, and this zone will probably be a bit of a dynamic variable, so it may well change depending on the presence of pathology or with increased or decreased strength and conditioning, for example. So taking this example one step further, let's put fictitious runner A in here in blue, and just highlighted where his leg stiffness is here by the blue line. As you can see, it sits within his zone of optimal leg stiffness. Now, just to stress, this is theoretical, and we wouldn't necessarily know in our clinics what a runner's leg stiffness was, nor would we know where it sat within their zone, or even indeed if they were in their zone. So hugely theoretical. But if we take this as fact, and this runner presents, and whether it be through something he has done or something we as clinicians impose, and whether it be by sort of luck or judgment, we introduce a scenario where we increase the stiffness of his leg. So now we move his leg stiffness north, but ultimately we are still in this example within his zone of optimal leg stiffness, but we're closer to the top end of it. So we've made his leg stiffer, but we haven't pushed him out of this optimal zone. Now theoretically, of course, we may have made him faster, because we know there is a relationship between velocity and leg stiffness. And in this scenario we would have a very happy punter, or we would have someone who essentially had taken it upon themselves to, say, change their technique. They had increased their cadence, made their legs stiffer, got away with it, stayed within their zone, got faster, and had a delightful result. Now let's take the same runner and assume that scenario changed to a point where their leg stiffness decreased, so it moved south of where it began. Unfortunately, it would, in this scenario, drop out of the bottom end of his zone of optimal leg stiffness, and therefore potentially increase his risk of injury. And in this scenario, we would probably expect it to be more likely to be soft tissue in origin. So this is an example of how a given runner could change variables and get away with it or not, depending on where they sit within their range. Now if we take exactly the same theoretical approach to runner B, whose leg stiffness is essentially in the same place, but he or she has a much narrower zone of optimal leg stiffness, as you can see in this diagram, the potential for injury here may be greater. So ultimately, whatever changes are made by luck or judgment, intentionally or unintentionally, and whoever they're made by, you may just find that this sort of runner won't get away with it. And we certainly see in clinic, I'm sure, I'm not the only one, we see runners who seem to get away with changes, copers as opposed to non-copers, who just don't seem to be able to get away with too much change. And far be it for me to suggest that this is the answer to all of it, but I think it's an important thing to consider in the overall picture. Now, just to clarify, we know that running injury is complex. We know it's multifactorial. We continue to research and investigate it, and we will do for foreseeable future. We certainly don't all seem to be in agreement about the for things that increase or decrease injury risk, and even if we were, we know that it would be different depending on the person in front of us. So I certainly don't want the take home here to be that it's all about leg stiffness and we not consider all of the other things. But like I say, I think it's just another thing to add into our thought process and another thing to consider. And clinically, at least, when asked these kind of questions, which I know I am on a daily basis, and I know I'm not the only one, just another thing to have in the back of your mind. So when someone presents, and these questions essentially don't have black and white answers a lot of the time. They're questions that I'm sure many of us would be reticent to give a real firm answer one way or the other to. But when someone presents asking about forefoot running because they read in a blog that it was better for them, is this true? Well, when we consider what we know about leg stiffness and essentially how forefoot running will probably change our cadence, and we know that will change our leg stiffness, we also know that when we're running forefoot we're going to have a change in the stiffness, the relative stiffness of our knee and our ankle. These are things I think to consider, and again, whether they're good or bad will very much depend on the patient or the runner or the pathology that's in front of you. And again, when people are asking about the level of cushioning on their shoes, do I run in an Asics Nimbus, do I run in a Vibram 5-finger? Two things to consider there. Ultimately, we know that foot strike may change in shoes of different levels of cushioning, not in everyone, but in the majority. So we know already, again, as we've said, how stride length will change leg stiffness. And I think when we're looking at something like the Hoka here, we look at that magnitude of cushioning, we have to be considering the alterations we are making to our surface stiffness. And like we said, if the central nervous system can, it will modulate the stiffness of our leg to achieve an overall optimal net stiffness with respect to the stiffness of the surface. So it's something I think that is well worth considering. So with all that in mind, if we take a sort of hypothetical clinical scenario, a runner presenting, say, with a patellar tendon pathology, the thought process here, if you take on board and you agree with all of the sort of literature to date, is that being that it's a soft tissue problem, it's likely that this limb may be working beyond the lower limit of its zone of optimal leg stiffness, and therefore essentially it's too compliant or not stiff enough. And in this scenario, an assumption could probably be made that the body or the central nervous system has lost the ability to make that leg stiff enough. So if we go along this train of thought, what some of our interventions should potentially look to do is to, again, make the leg stiffer. Now, what's one of the ways we do this? Well, for example, we could ask the runner to increase their cadence or decrease their stride length, which, as I'm sure you know, is ultimately the same thing. And this will serve to make the leg stiffer. Now, the really interesting thing is I actually gave this talk, as I say, 2012, and since that time there's actually been a growing body of literature which has sort of suggested that stride length manipulations is pretty favourable for patellofemoral pain. So that's pretty interesting. And now again, we know that there are other things at play there, but maybe, just maybe, leg stiffness is one of the things that is being modified. So I feel like I've rushed through this, and I probably have that's the cost of trying to make this a bit of a shorter video and therefore less or more likely for people to listen to it. But in summary, what we know is that we can do things which increase our leg stiffness or decrease our leg stiffness. Firstly, the surface that we're on, its compliance will basically change the stiffness of our leg, assuming the system is working. And remember, the surface isn't just the ground, it's the footwear, it's foot orthoses if they're present, etc. Joint flexions will change the stiffness of the leg, and that kind of comes under the realm of running technique, as does cadence and stride length manipulations, all things that are fairly easy to change clinically, and we just need to have a consideration, I think, of how they may be changing the leg stiffness. And again, that may be exactly the reason we're doing them. We need to acknowledge that sometimes we will want to make the legs stiffer, or we want to make them more compliant, but I think we need to be aware of when we may be doing that without knowing. And we already talked about the architecture of our feet, not something, again, we can change, but a further consideration on how the stiffness of the limb may be affected. So all of this is all well and good, and the very reasonable question to ask would be, how do we measure leg stiffness, and then where do we go from there? Well, clinically, we can estimate it, and I can do another presentation on how at some point, if people are interested. In the laboratory, what researchers will do is it's a fairly complex formula which involves ground reaction force and the vertical displacement of the centre of mass, along with horizontal velocity, contact times, etc. It's all pretty intense, but it is measurable. Normative data, however, is something that, again, as with most things, probably eludes us. We don't know what normal is, therefore we're kind of always looking at leg stiffness retrospectively and sort of assuming, I think, that if we see an injury, that almost reverse engineering what that may have meant with respect to the stiffness of the leg at that time. So as far as its clinical application, I don't think it's hugely measurable at this stage, at least not in a useful way. But I do think some of the things we've talked about are incredibly useful to consider, and that's all they are. They're considerations to add into our already vast and complex sort of armoury or weaponry with respect to how we approach musculoskeletal injuries. So I hope you found that interesting. It's a topic I find fascinating. I continue to read about it and learn about it. Happy to forward on any of the papers that someone has seen here referenced if they wish. Certainly don't profess to be an expert on the topic. As always, the learning continues, but happy to start discussions on this if people are keen. Many thanks again for listening.